called out in front of the entire audience. Well, good afternoon. This is our final session for the emergency preparedness track. We really appreciate you attending the full day. This is kind of why we say the visitor prizes to the end. We need to keep people stuck in there all day. My name is Susan Monroe. I'm with Virginia Department of Emergency Management, and we've been working with the Regional Catastrophic Planning team. And as part of that, I know you've heard Erica say this today, one of the things we were asked to do was to help put on the track on emergency preparedness for the HOEPS Center. So that's why we've been here today helping with this. Our last session is a little different. You guys came back and said, do you have any handouts? There's no handouts for this. What this is open dialogue. So I have 3 local emergency managers here. In a second, I'm going to turn the microphone over to them. They're going to introduce themselves, and I ask them each to answer one question. And that would be if you had one thing, one nugget, one wish that you could share with healthcare professionals about what you wish they were doing in the areas of planning or preparedness, what would it be? And so they're going to share that answer. After that, the way this session runs is, what are your questions for them? So there's no handout because you're the handout. So be thinking of what's that great question that you've always wanted to ask, but you haven't. Because this is your opportunity to ask an emergency manager that kind of question. Okay? And with that, I'm going to turn this over. Hold up these places. Mr. Breakout, you're first.
Good afternoon. Mr. Rob Breakout, I'm the emergency manager for the city of Chesapeake. Boston Beach. I grew up in Virginia Beach. Went to college in Oklahoma State University. And I've been the emergency manager there for about 6 years or so. For my one nugget, I've got actually nugget 1A and nugget 1B. Because I write plans. So the first thing I'd like you to know is your storm surge. I think that's a really simple thing you should just know as a facility owner what storm surge zone you're in. And if you were lucky enough to be in the city of Chesapeake, where we're top class, you can go to my website and look that up by address. Some of the localities you can do that too, but Chesapeake's the best for sure. So if you want to talk to me about that afterwards, I can idea if you want. The second thing that came up at lunch today when I was sitting with our folks from Chesapeake was there's a lot of confusion about what plans you give in the cities, okay? And even though I have a fire department shirt on, the fire safety evacuation plan you gave the fire inspector, that's not the plan we're talking about today. There's some confusion about that. Why gave the fire inspector my plan? Well, he's with the fire department, but he's in a different office. And his plan about how you do a fire drill at your facility is different than what we're talking about today. Much different. It sounds like there's a little bit of confusion about that. So if you're confused about what plan got to who and all that kind of stuff, I think you got to reach out to your emergency manager just sort of process. So that's another one I can do. And she likes walks on the beach.
I am Erin Sutton. I am with emergency management in the city of Virginia Beach. Large. with a beach. I've been with emergency management in the city of Virginia Beach for 2 years. Prior to that, I was with the Virginia Beach Health Department and was the emergency planner there, so some of you may recognize my face as I helped in facility plans. And really, I think one of the key nuggets that I identified not only when I was with the health department, but still over in emergency management now, is transportation is a challenge. I know that. And sheltering in place is the common thread for all emergency operations plans in these facilities. Think about evacuation. Write an evacuation plan. Even if it's just to your front doors, pretend the buses are out there. Because if it does turn, much like they had in New York City, you need to be prepared. Who's in charge of medical records? Who's going with the group? Who's staying behind to secure the facility? So even though your primary plan is shelter in place, you've got to think about evacuation.
Very good, Mayor. I'm Craig Moore. I'm with Gloucester County Emergency Management, and fire service. I've spent most of my time in emergency management and planning. I guess my most important thing is to go back and take a realistic approach to what you're doing. And there's requirements for plans and there's requirements for planning. But what is your most valuable resource? It's your people. What planning have you done for them? You're expecting, given an unknown event, for people to leave their homes, come to the facility and work for potentially 2 days, 3 days. Do they have a family plan? Have you been working with them in family planning? Are there single parents? Do they have the ability to leave their children for long periods of time and not worry about it? How effective are they going to be? Think about your people. Take care of your people, because those employees are going to take care of your people that are your clients and render good service and not be lost in what's happening and what the actual incident is. So that's my method.
Thank you. Okay, this is part of the program where you become the handout. So which hand am I seeing go up first? Because I'm going to bring a microphone over. And if you don't, I'll stop calling on you, because I'm just that way. I stop. Who are you talking about? I have 2 things. First of all, my name is Connie Pollard, I'm a consultant for American Home Health. And now that team has picked up that any agency or anyone who is federal money, saying that have to have this plan. What do you see as essential for home health agencies to do within the community? What we already have had place for all previous times, but we do identify our patients as to exactly what their evacuation needs are. We do ask what their plans are so that we do have those pieces of information. Most home health agencies have a structure where they contact each one of those patients every time that there is any kind of emergency impending to find out exactly if their position is, I'm going to stay put, I'm going to shelter here, or I'm going to be going to a common shelter. But what do you see as something else that home health agencies do in a community for their patients? What you say?
I think one of the key things with home health is arming your clients with the information too. And while you talk about evacuation and sheltering in place, which one they're going to do, and helping them decide, this is where the local shelter is going to be. What are you helping them with their preparedness plans as a whole? In getting them, making sure that they're on the Dominion list so that their power, they end up being on that. It's not the critical facility list, but their address is flagged. Are you educating them on who their emergency management contact is, or their health department emergency planner? The other piece to make sure with home health is, do you have a point of contact in the city? You have your list of who you've gotten in touch, and now you have 4 clients you can't get through to, you can't talk to. What is your process for tracking those people down? How can the city help? How can the health department help? How can we support you? So having a process in place, okay, I've gone through my 10 client list, and now I have 4 that I cannot track down, because you need to find what can we help to support you as well. So helping your clients with their own preparedness plans and making that educated decision is there go. And then on the home health side, making sure that your staff that works for you have the outlet to report, hey, I got 4 I can't get to, I can't talk to. What's the process? What's the protocol to get through that? And that's working with your emergency management.
I think one of the other things you can do is we had an absolutely horrible time in compliance to our functional need database that we've got a registry that's regional. They need to get on that database, not just with Virginia Power, so the emergency management people can identify and map out necessary where these clients are. The because if the tornado path is in that direction, you know, we may give a little special focus in terms of after we get through the emergent issue of doing a wellness check, and that's kind of important to us. If you're sending them away, make sure you have not just one, not just two, but 3 ways for them to reach back to you, because the first 2 inevitably are going to fail, especially if it's cell phone. So either have a place for them to call outside of the area that keep that information, so that you, if you're so inclined to keep up with what they're doing, what their status is, and when they plan to return. But you're going to want to know when they're back and providing home health care service back to them. So that's important information for you to have.
Did you have a second one?
Well, I just wanted to fill in. You had asked about taking care of your people. And at the time that this going through, I was working as a reference nurse at a long-term care facility. And what we did to take care of our people was to open up all of our common areas to our staff and their families. They brought the children, they brought in lower mattresses, they brought in the whole day before the storm was due to hit. So we had our activities person assigned to children, and we had movies, we had all kinds of things. The facility that we had at our staff had its own generator to the point that it was one of those that would, in high use area times during a regular summer day, we sold our excess energy back to the local electric company. So we were not going to be without power. So we knew that. So all of our people came into us, and it worked great. So our staff was there. Our staff was able to take shifts of sleeping so that they would need each other. So that we were there. Something that's sort of how and we did everything we need. So, 90.
Yes, I think that's excellent. I think that's excellent because from a responder's perspective, if I know that my family is in the same facility that I'm in, and though I may not be down there with them, but I'm focused on my mission, if I know that they're okay, and that when I get my break, I can walk down there and say, I see your face, you're good, I'm good. That's huge because you've increased their work productivity times 10, and you decrease their anxiety and their concern. You may not know their status at their home, but realistically, what's the most important thing? And that's your family. And if you've got that direct tie, that's great. Can your facility do that? Some are very limited in space or not, but maybe you can find a place and write that into your plan that if you're not going to evacuate out of the area to some place, that you can go here, and that you've worked that out, and you've done the same thing. There's advanced activities and you keep them energized and focused. So I think that's excellent. You should begin.
All right, she was brave and went first. You know what, I was always going to just bring you the mic. We talked a couple times today.
Good afternoon. My name is Scarlett Huang. I'm administrator for Envoy Williamsburg. I am in the area, so this is really wonderful. I don't know anybody. I met one of the gentlemen from City of Williamsburg. Is he going to be my emergency management manager?
Yes.
Yeah, I met him with him a couple of times. One thing, if any of you can help me, when was the last time City of Williamsburg had any kind of evacuation for the healthcare facilities? There's a hospital, assisted living, nursing homes, and what the nature of that? Thank you.
You may not know Williamsburg, but how about in your areas or in the surrounding jurisdictions?
You were very lucky. You're not in a flood zone. You're pretty high up and far away. Doesn't mean that you can't get falling water, like as in Floyd. Floyd created some problems with voids, and they had some inland flood. I don't know that anyone had to evacuate, but I don't remember the year, but probably somewhere around 96, 97, there was a significant ice storm that had the same damaging effect of a hurricane. We're taking out power lines, trees falling, and without power for an extended period of time. Again, I don't think they were evacuations of the medical care facilities, but it certainly stressed the response, and certainly stressed those people that were dependent, the medically fragile, the access dependent personnel. It absolutely stressed them significantly. Now, they were fortunately able to get resources from the peninsula side because it's a little warmer as you're closer to the water than the ice, so that didn't affect us, so they had some assistance there. But residents along the corridor from 199 all the way to Interstate 95 had a really bad ice storm that just really wreaked havoc on them.
Yeah, I mean, for the city of Chesapeake, we had several flooding incidents where we talk a lot about hurricanes, flooding events here too, but there's a lot of different types of hazards you really need to consider. I just want you guys to get, I guess, an all-hazard approach and think about things. And the thing that's crazy about hurricanes too is that, every storm is going to be so different. It's what it produces. I think it was like Lincoln County had like 100% payout. So it's up to the peninsula.
It's just beyond Williamsburg.
Yeah, so they just beyond Williamsburg. So they had more impacts than I did in Chesapeake in Duquesne County. So for us, there's every storm is different. We don't want to get into this mindset of, well, Irene did this, Isabel did this, so that means that this storm coming is going to do exactly that. That's a terrible probability mindset to get into. So just want every storm is different. It's going to result.
As I alluded to about talking evacuations, planning at least to the door, so you've identified staff. The other thing is, again, it's not always going to be a hurricane, it may be a facility fire, things like that to think about, is reaching out into your surrounding community and talking to those state days. We have a couple of nursing homes that have very large churches across the street, and they have had conversations, have that partnership now that if anything happens to the facility, such as maybe a fire in one of the wings or something, a power outage in one area, and they need individual help. Hurricanes, tornadoes, that's going to be something different, but facility issues, reaching out into your community. A lot of faith-based groups are really interested, especially the churches, to help out as much as they can. And really, those relationships, even in the hurricane scenario, that church may have a very large kitchen that may be able to help you out, help your staff out, if the facility's not big enough to house. So really reaching into your community and making those partnership connections. The localities are always doing public-private relationships because we can't do it by ourselves. There's 435,000 people that live in Virginia Beach, and that's not during tourist season. We need help from those private partners, and you all do too. So really getting to know your community and making those partnerships is important. It can help you on the smaller scale issues, but can also maybe in the long term be an asset.
One follow-up thing that in the city of Chesapeake, well, just in the region in general, everybody steals plants from everybody. Well, they steal plants from me all the time. But what I'm saying is, if you want to share, you want to use these events to network and meet other people, and I don't know, she's got a great plan in Chesapeake, and so she's happy to share that with other folks, and so you want to reach out and hit those other folks. But a lot of what we're talking about, this all hazards approach, is basic business continuity. And if you go to ready.gov has an insanely good section on business continuity. No matter what the hazard is, if you go through their process, it's like an 8-step process on business continuity. It has all the templates, all the forms are on there, how to do a business impact assessment, and all that kind of stuff. All on ready.gov. It's really, really easy to follow. We have a lot of businesses in Chesapeake that get together and do them in unison. So Cox Communications, Jimmy Gilmo, they got together and did one joint. So there's opportunities for collaboration, I think, that some business kind of forget about sometimes.
Thank you. Okay, you guys understand how this works. So one thing that happens is I start targeting people for, that haven't raised their hands. Who's got a question?
This is easy.
Yeah, these are easy questions. They're not hard. Oh, thank you.
I manage dialysis facilities in multiple cities. Is there one resource where I can get the contact for each emergency contact?
ReadyHamptonRoads.gov.
Yes.
Or the Ready,
Well, your answer is going to be a little my answer.
ReadyHamptonRoads.gov.
ReadyHamptonRoads.gov.
I was going to
Get that financial.
No, but I mean, there's several regional meetings happening in Hampton Roads too. Well, not several, there's like 635 regional meetings that we have all the time amongst various different groups. But one time we had the dialysis, like the stakeholders from the dialysis group come and meet with the REMTAC group. And that stands for Regional Emergency, I'm the vice chair of this group. Regional Emergency Management Technical Advisory Committee. And we had the group come in, and it was just a one-on-one thing. There's an exchange that can go on there. So, but there's just lots of different stakeholder groups, emergency managers meet with, and I think that's something that maybe as a dialysis group you can come forward and say, hey, we'd love to meet with you guys once a year, something like that, do a presentation, whatever it is on your facilities. Because things change. You guys close businesses or change locations. That's stuff we want to keep up on. But again, ReadyHamptonRoads.gov. It's or actually it's .org for a while, isn't it? What is it? .gov? ReadyHamptonRoads.org. Thank you, Martha. Okay, you earned your paycheck again.
Have any more of the flyers back there? Yeah, if they pass.
There is a healthcare coalition as well in the region that I know has some representatives. But the Eastern Virginia Healthcare Coalition is another group. And correct me if I'm wrong, is the Mid-Atlantic Renal Coalition still a group that meets and coordinates? Because I know they had a representative that was active a few years ago on some of the regional meetings that we have. So we try and tie in as best we can with all the different groups.
And Jen Foster's here.
Yeah.
She is.
And Jenny Foster's here.
Not maybe in this room, but she's.
We've got some extra Hampton Roads in that. Do they need that? Get that website. All right. Who's got a question? You know I'm going to come back over here because a lot of people sitting there. If I'm trying to. No, they do. I'm going to make you stay here. This is going to be my quiz. So. This truly was just an opportunity for people to ask questions. The handle? Oh. This is my ringer for the tough question. And, well, it's not really a question for me because I'm with BDM. I'm the new state bound or voluntary agency liaison. And then, kind of briefly, so I'm trying to think as a healthcare provider, and your comment was about evacuation planning. And do you have any tools or resources to help them think logistically when it comes to that evacuation? How long, how many vehicles, transportation, how long, turnaround, stuff like that, that can help them think through that process?
The city of Virginia's destination.
Part of the process and sitting down with the healthcare facilities that we've talked to is, what's your head count? And then the second question is, what's your realistic head count? Because your ambulatory and your bed bound, especially in long-term care facilities, changes on a daily basis, correct? And really thinking, prioritizing who's got to go first. This has been my approach in being in the healthcare facility. It's not to think, I've got 50 people got to go. How do I get in the door? What kind of bus do I need? Do I need ambulances? Think of your 50-bed facility in a prioritization structure. Who do you have to get out the door first, second, and who can go flying out the door last? And then staff has got to go with first, second, and third. So how do you spread out your staff? So before we even talk about time And this is why I talk about evacuation is important to have a plan and have that discussion at least to the front door. The buses are sitting there, but if you don't have a plan, you're never going to get those 50 beds out the door regardless if the buses show up or not. So if you in your 50-bed facility have 30 that are ambulatory, they can sit in a charter bus, you need to think through. They're going to Richmond, Roanoke, Lynchburg, wherever the destination may be. What do they need to have with them? In the discussion across the hall, I was doing the kind of the tabletop exercise with some facilities. I talk about a one-sheeter. How quickly can you get a one-sheeter on each of your residents of your facility? What's their medical conditions? What medications are they taking? What are they allergic to? Who's their next of kin? What's their contact information? That's a big thing. And how do you stick it to them? How do you attach that information to them as you get them out the door? So a lot of the logistics, emergency management is good at talking about logistics and thinking about kind of this little thing. Not necessarily that timing, because I don't know when I'm going to get you the buses, or can get you the buses, or where that bus is going. But if that bus is sitting there, do you have that plan in place that you have 40 people on the bus, you have 15 staff, the medical records, the pharmaceuticals, the wound care stuff, all the things that you need to think of as that bus is going down the road. You need bottles of water, what traffic's not moving, things like that. So logistics-wise, emergency managers, we're good for thinking. And part of it too, some of us have a healthcare background, some of us don't. We can kind of think outside of the box for you as well. But we can kind of do the logistical run-throughs with you, because you see your residents every day. You may know exactly what Mr. Smith needs and Mrs. Jones needs, but you may not be the one that's going. So at the other end, is there that information to communicate Mr. Jones and Mrs. Jones' needs in order to have that continued care for them? Logistics are a big thing. And that's why I emphasize the evacuation planning, because logistics is not something you do on the fly. Because you may need to order zipper pouches that are easily pinned to a patient, and thinking about those things that you need to have on the shelf and ready to go.
Yes, to segue on that. Does your staff know that your plan is, when they show up to work Monday, that Tuesday they're not going to get to go home? And oh, by the way, you're going to send them to Richmond with the clients, and they may not come back until next Monday? That's an expectation that you have, and you need to communicate that expectation to your employees. Your employees need to have a plan that lasts that long. They need to have go kits for them. You don't want to send your employees out the door for 3 or 4 days and pay them stay early. Yeah, and as long as I have my cell phone in my dossier and I have this, I'm good for 4 or 5 days. I can wear the same clothes. You want your employees wearing the same clothes? How do you think they're going to feel about that? The other thing is go back to the portal to portal. How are you getting out of here? If they are able to get on a charter bus, that's great. They've got a bathroom. If you're thinking something else, a school bus, they don't have bathrooms. You can't take them very far. If you're leaving your city limits on a school bus, you've gone too far with that asset. So think in terms of, how do I get from point A to point B? Where are you going? When you leave, where are you going? How long is it going to take you to get there? And then multiply that times 2. Don't run out of fuel, sit on the side of the road and become a medical nightmare for somebody, 90-degree temperature. You make it through camp, all of a sudden you've got 60 people on a bus that are now heat stressed and are in need of significant medical aid, because when you start getting that far out, the resources to respond to them starts to drop. So you've really got to look at this. You've got to look at how your people are getting moved in full circle. And as Aaron said, you've got to have a plan. You need to have a backup plan. And if you're using, we can help you with identifying people that are contractors for various things, buses, ambulances. VDM has a long list. We can put you in contact with them. We're not going to negotiate your contract for you, but we can give you a point of contact to help you with that. But have not one, not two, but have 3 plans, backup plans for those vendors, because they're all going to get hit at the same time with the same request.
Follow up on that too. Another thing Greg's talking about oral is patient accountability. And when I was in the JFO after Katrina, that was a huge issue. We were working on constantly was where the nursing home folks were, where they went. And what was really interesting to me as a young person's intern at JFO was that a lot of the nursing home folks, directors, were like, "Why do you want that information?" Like that I had left and where I was going. Like I didn't think that was important to tell you. And I just went from a suggestion perspective. When you pick up and go, I'd like to know that. It's a good piece of information to share, and who's going, and where you're going. I'd love to have that information because the big one comes off, and we're going to have a lot of people calling, looking for family members, things like that. What information we can have to help, it's going to help everybody in the whole situation. So I just want you guys to understand, sharing information is something we want to do, for sure.
Thank you. Any other questions?
They're quiet back there.
I know they're quiet over here, but I know they have raffle tickets. Unless there's some questions, and I'm gonna go back, in the last session, we handed out calendars, little desktop calendars, and they aren't a calendar that says, I can cross off the days of the month. They're a calendar that says, in the month of January, have you thought about answering these questions? A lot of the things I'm hearing you talk about, if you go through those calendars, you're gonna see those questions in there. We pulled them from, the Ready websites and some of the forums, and we pulled them from seasonal things, like before hurricane season. Do you have all your medications together? Do you know what they are? You have that list, you have some in a go kit. Because that's the time of year, before June, you want people in healthcare to be thinking about that, because when it hits, you want to grab it up. And so we try to organize it so that each month those questions relate to what you might be preparing for. If you didn't get those calendars, we still have some in the back, and our goal is to not take them home. So, just put that out there, okay? Any other questions for our local emergency managers? Oh, love it.
Ed Howard from Lincoln. Officer, a question for you on this. With all the active shooters going on, I hear a few planners discussing that they don't have the resources, the funding to procure lockdown features for facilities. So there are issues going on about it. They're actually trying to foster folks to respond to doors, secure the facilities where you have lockdown. Twofold question: is there a way forward in? I know the funding constraints are pressure. Is there a way forward into converting assets like that for our local facilities? And two, the communication on training. I find that odd that they would focus in harm's way to run out sort of what's going on.
Right. Yeah. So there's a ton of work going on in the active shooter space right now, obviously, because there's a lot of incidents happening. So that's what we do a lot of work in, unfortunately. But so the first answer is there funds available for access control and physical security at sites, things like that? The answer is yes and no. The Hampshire region was recently restored as a WASI, which is a designation of a high-risk area in the country. And with that comes a grant fund called, it's like a nonprofit WASI grant fund. Okay, there's a really long federal name, right? And those grant funds is $13 million nationally for access control and physical hardening for sites that are vulnerable, nonprofit sites that are vulnerable. So you have to fit that nonprofit 503(1)C, FG, ABC category or whatever the say it is. But typically you see that money used a lot on like synagogues or faith-based sites that are a threat. Okay, So we'd have to do some research on that to see if a healthcare facility would be able to meet that out on that. And then to the training, the problem with active shooter is that just like every storm is different, every facility is going to be different. What you do in a school, what you do in a mall, what you do in a nursing home, when somebody walks in with a gun, it's going to depend a lot on that facility. So the standard mantra that's out there right now for active shooters is run, hide, fight. Anybody can Google that video, run, hide, fight. It's a DHS product out of Houston. And that's kind of become the sort of active shooter training norm right now, is run, hide, fight. It's a violent video, let me point that out. It's not something you're going to want to sit down and watch with your 7-year-old. But it's a good training video for adults. It's going to jar you into making some decisions. But what it's going to do, though, is more than anything, from your all's facility perspective, it's not like some of the folks in your facilities can run, hide, or fight, right? So you're going to have to do some analysis on what you're going to do when somebody walks into that. What are your lockdown procedures? A lot of stuff going on, and there's actually no simple answer. That's the problem. It's such a complex.
You said you were from a military installation? Right. In terms of facilities, obviously as a federal facility, military facility, you've got avenues that aren't open to the locals. There is a challenge if you're talking about like a school in the city of Hampton. The locality could potentially put in for a grant. And it's not something that the city owns or the county owns. We're kind of prohibited from using tax funds and so forth for private. We've got a couple of places in our county that we would love to help, even with generate power, but we're kind of precluded from spending that grant money other than the locality specifically and what it's identified for. Hardening of a facility is something that is a really difficult challenge. It's kind of like your insurance policy. You absolutely want to do it because you don't know when you need it, but then you spend a lot of money and you don't use it. That's kind of hard to get for us to justify it with budgets as tight as they are. There's absolutely a need for it. Hopefully we'll never have a situation like that, God forbid, this area. But the run, hide, fight is definitely the way that we want to go in terms of that's low-hanging fruit, it's training, and people can understand that. I do believe that the school systems across the region have put together a process and a program and have done pretty well in terms of securing their facilities. Compliance to that, of course, that's going to be school-based. Every different school tends to follow things a little bit more rigidly or not based on who the person at the helm of the ship is, the principal. I think that in our county, we've taken that very serious. You can't get into Gloucester High School without going to the main gate and showing a photo ID and being escorted unless you're a parent. I can't say that that's the case in every locality, but they've taken that pretty serious. And you can walk up to the county administrator's office with no problem.
I was going to say, one other training option, the Department of Criminal Justice Services has a school safety program, and they recently put out an free online training that played off on Department of Homeland Security provided. You know, it's school specific, but I was one of the people who helped edit and put it out. But it really takes you through the thoughts of how does your plan work in protecting your people in whatever kind of facility, what are the steps. It's not quite as graphic. So it's a little more in-depth, a little more plan-focused. I realize it talks about schools, but if you think about some of the similar configurations, hallways, multiple rooms off a hallway, there's some similarities there, so you might want to look at that to get some additional ideas.
We have an open campus, if you will. We have one road of ingress, egress, just a guard gate, which we know doesn't really stop anybody. All our buildings have automatic doors with no locks on them. They've never been locked because all we hear is, well, that will break or be against the fire code. You know, if there's any precedent set for putting a lock on these kind of doors in the need of a lockdown or in the name of a lockdown?
The fire code is very specific in terms of what can and cannot be locked. That cannot. However, if you look at that, what it's you're talking about is blocking egress. You can lock a door from the outside where people can't get into your facility. Perfectly acceptable. First responders are going to have the ability to either have a key or an access to it. Can't block going out. That's against the fire code. So in terms of blocking off parts of your facility where people can't get in, if it's on the inside, that means if it's an egress, then it cannot be. If it's marked exit, you cannot block that. Can you come up with a security system? Absolutely. You can, given a priority or an issue that's transpiring, shots fired in your building. If you've got enough money, build your system to where you can pull levers, push buttons that will lock doors and lock that down. They do that in prisons. They do that in jails. That's expensive. An open campus is a challenge. They designed it that way for a specific reason. To overcome that, it's going to cost you. But there's a way to do it. Access and egress can't be blocked in terms of inside the facility for people to move in and out. Outside of that door, the outside doors absolutely can be locked. Does that answer your question?
Not well, but here,
Can't change the answer, but
we just did an active shooter exercise with a business partner in Chesapeake, and what we learned is something that for all facility owners, you want to test your plans. That's one of the big things that we're talking about. Is not just write the plan, put it on a shelf. We want to test that plan. So when we went to this facility, the guy said, "Well, we're leading up to the exercise design part." He says, "Yeah, what's going to happen is somebody's going to probably pull the fire alarm, okay, and then that'll open all the doors so that the police, when they're responding in, they'll be able to get in. Sure shoot, somebody pulls the fire alarm, their system malfunction, and a lot of doors. So there's all the police, there's an active shooter inside the building, and now all the doors are locked, and so they can't get in. So, in an exercise, you can't ram through the door and get in there and do all that stuff. But so it was an interesting learning experience for this company that they had their system designed a certain way. It did not behave that way at all. So one of the little after actions that we've got is for our Knox boxes. Everybody know what a Knox box is at the facility. So there's some access code cards in there for the access for the police guys. So the Knox boxes are typically bought as fire things. The police are going to be the ones getting there first for the active shooters. So you got to kind of think about that as a
and one last thing, money spent. If you've hardened your facilities and you've secured your doors, it kind of goes back to the old adage of fighting the strip malls. Everybody's got a strip mall in their area. You got 5 or 6 stores that are all associated with one roof line and stuff. You ever try to look at the back doors? They're steel doors, bars, secured, chain. Once they're closed, those businesses, you can't get through there. Take a sledgehammer, right next to it is a brick wall or a concrete block wall. So you take all the security measures, and I ask you, how close is the next window to that door that you spent all the money securing? Because that's going to be the path of least resistance, or like Rob said, get people to come out. Open the door for them. Huge security issue, and there's probably security consultants that would be willing to talk with you specifically.
All right, any other questions? There's no answer to that. Okay. Susan? Yeah, okay. Yeah. Questions from the panel? The emergency management planning review criteria, who has seen this matrix or been provided this matrix? The Virginia Department of Health with Virginia Department of Social Services and VDEM and VDMH and RSAS got together and put this together based on a guideline for you to put your plans together. A criteria. What's required by law to be in your plan? What does emergency management recommend you put in your plan? And what's the kind of good information you have in your plan? And it's a checklist. And it's for this particular one, assisted living facilities, adult group home, nursing facilities. There's one for child residential, adult daycare, one other one. But it's available on the Virginia Department of Health website. Not the easiest to navigate, so if you can't find it, call your emergency manager. It's also on the VDEM, or the Virginia Department of Emergency Management website. If you have a plan that was handed to you as you walked into the door and said, welcome, this hasn't been reviewed in 5 years, or you have a plan that still has some pages that says call 911, and you need help updating your plan, this is a great start. Because I promise you, this is what emergency managers use to help review your plan. It's just an easy, it has the category of what's required by social services, what's required by BPH, what would emergency managers like you to have. I really encourage you to take a look at this and use it. Review your plan with this checklist. What key pieces are you missing? And the other nugget, my end nugget is your plan does not have to be 750 pages to be a good plan. Checklist, bullet points, easy to read, easy to access, easy to review, and easy to test. If you welcome a new employee into your facility and give them 4 3-inch ring binders and say, review this and commit it to memory, how's that going to work for you when the tornado comes? Keep it simple. You do not need a dissertation to protect your facility. You need a plan that's easily understandable, with easily identified roles and responsibilities. The medical records coordinator is responsible for this, and this. So when the disaster happens, that coordinator can rip that page out and go, okay, I did that, okay, now I need to do this. Benchmarks is another good piece to put in plans. At 145 hours prior to the storm, we will have completed this. At 24 hours prior to the arrival of tropical storm force winds, we will do this. Checklist and bullet points. Any last questions? It's been a great conversation. This is the emergency management planning review criteria.
On the health department, or VM has a page, emergency management, and it's like forms, plans, handbooks that links right off of that.
But the best way to get this, if you haven't met your emergency manager, call them up. Say, hey, I need that guy. I need that criteria matrix that Aaron talked about. And
Or say Rob, and that way you don't blame him. Rob. Anything else?
Before we get to the final outline, there's one we have for our panel, and we've been giving our presenters throughout the day. Our panel members, we have these 8-inch digital photo frames already preloaded, which, well, not fully preloaded, but 40 photos of the Hampton Roads area. So we give our panel a round of applause. So first up the graph, we have 794-905. 905.
That was a near miss. That was a near miss.
She already be prepared. We're having volunteers.
We have a basic emergency preparedness kit, also from the American Red Cross. All right, final winner is going to be 794-900. 794-900.
Winner in the back.
All right. Thank you all so much. Make this day very, very successful.
Yeah.
So didn't Hampton Roads go after my Virginia doctor?
You replaced them.
I don't know. May 21st, maybe.
It was on